So now we're going to move on to talk about the neuroeffector junction. And the neuroeffector junction is the area where a postganglionic neuron synapses onto an effector organ. And again, because we're talking about the autonomic nervous system, the effector organ here is what type of tissue? What are some examples? Smooth muscle, I heard that. What else? Where else does autonomic postganglionic neuron synapse? Where else? Cardiac muscle and glands, right? And then the sympathetic adipose tissue. So smooth muscle, cardiac muscle, and glands. So the area where a postganglionic neuron synapses onto one of those effector organ tissues is called the neuroeffector junction. And it's going to differ in a few ways from an ordinary neuron-to-neuron synapse. Okay? It's going to differ in that there are not axon terminals here. Instead, there are swellings called varicosities. Okay? Let's see what that looks like. Any questions so far? You guys in the back hearing me okay? Okay, thanks. Okay. So we have our postganglionic neuron. And please excuse my drawing. So we have our postganglionic neuron, right? And as we said, they're not discrete axon terminals at the neuroeffector junction. The axons end and they sort of just synapse onto that effector tissue. Now again, this is likely going to be either smooth muscle, cardiac muscle, or some type of gland, all right? Let's take an example of smooth muscle. Now, instead of axon terminals, what we have here are swellings called varicosities. All right, so these are called varicosities. Okay. Now, if we look closer at what happens with a varicosity, so let's just draw this a little bit more magnified here. So this is a varicosity or swelling, and this is the smooth muscle tissue here. Now, within the varicosities are some vesicles, and they're going to have your neurotransmitter. Now, I want you to bear in mind here that depending on what type of neuron this is, the neurotransmitter is going to change. We saw that already. If this were a postganglionic neuron in the sympathetic system, what would this neurotransmitter be? Postganglionic sympathetic system. What would the neurotransmitter be? Come on, we just discussed it. It would be norepinephrine, right? Postganglionic neurons of the sympathetic system release norepinephrine. But if this were a postganglionic neuron in the parasympathetic system, what would this neurotransmitter be? Acetylcholine, acetylcholine, okay? Now, there's an action potential being propagated along, let me see this still, yeah, along the length of this axon. And when it gets to a varicosity, it's gonna trigger some voltage-gated calcium channels in the membrane here to open up. And when these voltage-gated calcium channels open, calcium is going to rush into this varicosity. That's going to cause a process called exocytosis, where these vesicles move to the membrane, right? And then dump their contents out into the synaptic cleft here at the neuroeffector junction. So they're going to dump this neurotransmitter out into the cleft here, and it's going to have to cross. Now, the second difference between a normal neuron-to-neuron synapse and the neuroeffector junction is going to be the width of this cleft. So it's going to be a much greater distance to travel than in a normal neuron-to-neuron synapse, okay? So those are the two differences you mentioned. One is that there are not axon terminals here. Two, the width of this is different. The width of the cleft here is different. Now, depending on what type of neurotransmitter this is, again, that's going to depend on what type of neuron this was. It's going to cross and it's going to bind to a receptor. So let's just put a receptor here. And again, what type of receptor this is going to depend on what type of neurotransmitter this is. If this were norepinephrine in the sympathetic system, what type of receptor would that be? What type of receptor would that be? What type of receptor does norepinephrine bind to? Adrenergic receptors, right? Adrenergic, so either alpha 1 or 2 or beta 1, 2, or 3. Those are all adrenergic receptors. And again, if this neurotransmitter were acetylcholine, what type of receptor would this be? What type of receptors do acetylcholine bind? Cholinergic, thank you. Cholinergic receptors, right? And specifically at the neuroeffector junction, this is going to be a muscarinic cholinergic receptor. It's not going to be a nicotinic. Okay, question so far? All right. So let's actually also talk about the enzyme called acetylcholinesterase. And acetylcholinesterase is an enzyme that lingers around at the neuroeffector junction, and it could possibly chop this acetylcholine that's hanging around here into acetate and choline. Okay. Now the choline is going to go back into the varicosity, and it's going to be recycled to make more acetylcholine. I'll repeat that bit. So acetylcholinesterase is an enzyme because if we keep that neurotransmitter hanging around at the neuroeffector junction, it will continue to excite that tissue. And we're going to see some toxins that do that, that cause muscle spasms. So we want to clear that neurotransmitter away either by diffusion or by acetylcholinesterase actually cutting those molecules into acetate and choline can be recycled back into the varicosity to make more acetylcholine. Question? Same thing as reuptake protein that we learned about. Yeah, same reuptake protein. Okay. Okay, so this slide summarizes what we just talked about. An action potential is going to arrive at a varicosity. It's going to trigger the opening of some voltage-gated calcium channels. Calcium rushes into the varicosity, right? Triggers exocytosis. Acetylcholine is dumped into the cleft. It'll cross and bind to either an adrenergic receptor, if it's norepinephrine, or a muscarinic cholinergic receptor.